My paper is about panic disorders. Panic attacks or panic disorders is a discrete period of intense fear or discomfort. Symptoms include pounding heart, sweating, trembling, shortness of breath, feeling of choking, chest pain, feeling dizzy, unstated lighthead, or faint. Depersonalization, fear of losing control or going crazy. Fear of dying, chills or hot flashes are all symptoms that can be associated with panic disorders. Symptoms develop and reach peak within about 10 minutes. Usually there's no warning when you're going to have a panic attack. A lot of times people develop intense anxiety between episodes, always worrying when and where one will occur next. In rare cases, panic attacks can last up to 1 hour for someone. Panic attacks strike between 3 and 6 million Americans worldwide every day, and is more common in women than in men. Panic attacks can occur at any age in children and the elderly, but most often in young adults. Not everyone who experiences panic attacks will develop a panic disorder. Some people have a panic attack and will never have another one. A person with a panic disorder may have unexpected panic attacks from once a month to once a day. Between attacks, people usually have persistent concern or anxiety about having additional attacks, worrying about the implications of attacks or consequences, losing control, having a heart attack, and going crazy. A significant change in behavior related to attacks, agoraphobia, may also be present but isn't required in order to diagnose a panic disorder. The panic attacks may not be due to direct psychological effects of use or abuse of substance, such as alcohol, drugs, and medications, or a general medical condition. Panic attacks may change people's behavior and function at home, school, or work. People with a disorder often worry about the effects of their panic attacks a lot. People tend to have depression with panic disorders. Panic attacks may include anxiety about being in a situation where it's difficult to escape, such as crowded places or traveling by car. People are also scared to be alone or far from medical help. Many people who have panic disorders first seek treatment at the emergency room because panic attacks can often feel like you're having a heart attack. When you say you're having a panic attack, you will be given a physical examination, also a psychiatric evaluation. Blood tests will also be done to rule out any other disorder that you could have with some of the same symptoms, or substance abuse is a disorder that mimics a panic attack. A lot of people with panic disorders are placed on medicine or cognitive behavioral therapy. It helps people understand what they're going through and how to deal with the effects of a panic disorder. I think I feel so strongly about panic disorders because I myself and my mom go through panic attacks on a daily basis. I have had them for 3 years and my mom has had them for 6. I remember when she first started having panic attacks, she always thought she was having a heart attack. We would take her to the hospital every day. It seemed they would find nothing wrong with her. Every time we would go to the hospital, it would be a different symptom. They ran every kind of test you could possibly run. She went from being outgoing and doing everything to barely coming out of her bedroom and not talking to anyone. She stopped working for a year to try to deal with the symptoms she was having. No one could ever diagnose her with a panic disorder, so we never knew what was wrong. We thought she had went into a state of depression. Until one of her friends had the same issue and told her to go to her doctor and mention panic attacks. The doctor started going over the list of symptoms and it fit her completely. She was finally diagnosed. She was able to get medicine and start to have a normal life again. A lot of people truly don't understand a panic attack. I know I didn't until I had one myself. I always thought it was in your head, but really you can't control the symptoms when they come. There are also many people suffering from this disorder and don't even know it. People's lives become restricted and avoid normal everyday activities such as grocery shopping, driving, in some cases can't even leave their house. Sometimes if someone they trust is with them, they will be able to go out in public and do stuff. When diagnosed with a panic disorder, the goal of treatment is to help function well during everyday life. A combination of medication works best, doctors have found out. Symptoms tend to get better within a few weeks. Some people with disorders are never cured. Only treatment can help a little bit. I hope this gives you a better understanding of this disorder and will learn not to judge people. Sometimes they don't know what they're going through and they can't help it.